Cancer Sequist, how should a newly diagnosed patient facing lung cancer respond in situations where they encounter lung cancer stigma? There's a stigma that kind of surrounds lung cancer sometimes. How would you recommend that they deal with that?
You're very kind. There's this, in my opinion, there's a stigma that surrounds lung cancer all the time, and it's unfair. And I think, if we look back, there were a lot of public awareness campaigns, on TV and in magazines in the 1980s about quitting smoking. And there, you probably remember these ads that showed people like breaking the cigarettes in half. And I think the intention of those was good, that they were trying to explain to the public that smoking could be harmful for your health. But it was just much too simplistic, because quitting smoking is really hard. It's an addictive substance. Nicotine is addictive, and it's very, the way to treat addiction is usually not to just say, don't do that, don't do that. Like there's medically more sophisticated ways to treat addiction. But I think the flip side of that awareness campaign that smoking can be harmful for your health is it really ingrained in our culture this very deep-seated thought that if you choose to smoke, you've made a bad choice. And that's just, it's so problematic, because most people didn't choose to smoke. It was basically provided to them in this very complex and high-level targeted campaigns from the tobacco companies. And most people would like to choose to quit smoking if they are smokers, and they can't, because it's an addiction and it's very challenging to quit. So basically, I think this is all to say the stigma around lung cancer comes from this misguided, false impression that a lot of Americans hold, that lung cancer is because people made a bad choice to smoke or to not quit smoking. And so it all comes together to make people think that those who get diagnosed with lung cancer did something wrong to deserve it. And that's just not true. Nobody deserves to get cancer of any type. And lung cancer patients do suffer this unique blame that is not necessarily placed on other patients with other types of cancer. It's really very unique to lung cancer, and it can be harmful for patients in many ways. It can be harmful in interpersonal interactions, but it also leads to policies and the whole way that our care system is set up that disadvantage lung cancer patients compared to other types of cancer patients. So there's a lot of people working hard on this problem, but something that you can do, I guess my activation tip for this question would be to just spread the word about lung cancer, whether or not you have lung cancer, maybe someone has lung cancer, but just tell people, lung cancer can happen to anyone. Lung cancer can happen if you smoked, if you never smoked, anything in between. Anyone who has lungs can get lung cancer. And we have to take this stigma away from this disease. Nobody deserves to have lung cancer. It's not something that people cause to happen to themselves, and they certainly shouldn't be blamed if they are finding themselves in a position where they have lung cancer. So just spreading the word, lung cancer can happen to anyone. Anyone with lungs can get lung cancer, I think, can help start to change the perceptions.